Welcome to Optimal Anesthesia, the platform where we dive into the world of medical innovation and honor the unsung heroes of anesthesia. In this episode, we're stepping into the fascinating realm of peroral endoscopic myotomy, or POEM, and the vital role anesthesiologists play in ensuring its success. Imagine a condition that disrupts the harmony of your esophagus, turning each swallow into a battle. That's achalasia cardia, a silent struggle faced by many. Symptoms like difficulty swallowing, chest pain, and weight loss paint the grim picture. A rare condition, but for those wrestling with it, it's a relentless challenge. Now, picture a procedure that marries the precision of endoscopy with the art of minimally invasive magic. Meet POEM, the superhero swooping in to rescue achalasia patients. Since its debut in 2010, it's been rewriting the rules of treatment. Absolutely. It's not just an innovation, it's a lifeline. Smaller incisions, less pain, and speedier recovery, that's POEM in action. Stick with us as we delve into the pivotal role of anesthesiologists in this medical revolution. They're the unsung heroes of anesthesia, ensuring patient safety and comfort while facing unique challenges head-on. So, imagine this, a carefully orchestrated dance of endoscopic magic and surgical precision. Let's break down the steps of a typical POEM procedure to demystify the process. Step 1. Patient positioning. Picture the patient either comfortably lying down or chilling in a left lateral position. Why? Well, we need easy access to the esophagus and the gastroesophageal junction. It's all about setting the stage. Now, let's clear the stage with Step 2, preparation and clearing. We're talking about a meticulous cleanup using an esophagogastroduodenoscope. Think of it as the crew making sure everything's spick and span before the show begins. On to Step 3, carbon dioxide insufflation. Imagine a gentle introduction of CO2 into the esophagus, creating a safe working space and minimizing any pesky complications. It's like inflating a balloon, but with surgical finesse. Now, things get colorful with Step 4, mucosal bleb creation. We're using a mucosal cap and a vibrant dye mix to enhance visibility. It's like painting a canvas to mark the submucosal space, a critical zone in the POEM masterpiece. Step 5, mucosal incision. Cue the electrocautery knife. A precise cut opens the door to the submucosal tunnel, a key element in our storyline. Step 6, submucosal dissection. Picture an intricate dance of the electrocautery knife, sculpting a submucosal tunnel like a surgeon with a laser-focused brushstroke. Dyed saline injections assist, making it an artistic collaboration. Step 7, selective myotomy. We're reaching the climax. The circular muscle fibers are cut, sparing the longitudinal ones. It's surgery meets poetry, a delicate balance extending to about 2 centimeters below the gastroesophageal junction. And now, Step 8, closure of mucosal entry point. It's the grand finale. Using hemoclips, we restore the esophageal lining's integrity, sealing the performance with a flourish. And there you have it, the magical journey of a POEM procedure. A symphony of medical expertise, precision, and a touch of artistic finesse. Let's dive into the world of preoperative investigations and fasting guidelines for POEM. First on the checklist, cardiac evaluation. Imagine this as the backstage pass to the heart. Patients with chest concerns or cardiac risks undergo an electrocardiogram, ECG, like a musical warm-up, ensuring the cardiovascular stage is set. Next spotlight, pulmonary assessment. Picture a cinematic scene with suspicions of lung drama. A chest X-ray takes center stage, investigating the pulmonary plot to detect and address any potential respiratory twists. Now, let's talk about the rhythm of fasting guidelines. It's a hot topic, folks. No universal rule for POEM fasting, but the consensus is emerging. Picture it like chefs discussing the perfect recipe: clear liquid diet for 24 hours or a low residue diet for 48 hours before the big culinary event. Why the pre-fasting drama, you ask? It's all about reducing risks. Achalasia patients are prone to esophageal acrobatics, and an empty stomach ensures a smooth performance, minimizing the chances of complications. Now, the EGD debate takes center stage. Imagine a medical courtroom. Some argue for the necessity of prophylactic EGDs, while others warn of increased risks without it. The decision? Well, it's like a jury verdict, based on individual patient characteristics and clinical wisdom. And there you have it, the backstage secrets of the medical world. Cardiac overture, pulmonary plot, fasting drama, and EGD courtroom, all leading to a safe and well-prepared performance. The operating room, the patient comfortably under general anesthesia, and the meticulous touch of endotracheal intubation ensuring every breath is a controlled symphony. This isn't just a procedure, it's an orchestrated dance of medical marvels. Now, why the spotlight on general anesthesia and endotracheal intubation? Because, my friends, they're the unsung heroes setting the stage for the physiological theater about to unfold. As the patient slips into a controlled slumber, the body responds with a rise in mean arterial pressure and heart rate, like a silent overture preparing for a grand performance. But fear not, dear listeners. These physiological shifts are not random. They're the body's way of responding to the intricacies of POEM. The use of carbon dioxide, our preferred backstage crew member, ensures safety with its non-combustible, water-soluble nature and a swift exit from the body once its role is played. Now, let's venture into the respiratory realm. Picture a continuous influx of CO2, an essential element in creating that submucosal tunnel. But, like any good party, if CO2 overstays its welcome, respiratory acidosis may make an unexpected appearance, a bit like a lingering guest overstaying the celebration. And here's where our plot thickens: the elevated peak airway pressure. It's the telltale sign, like a rising crescendo in a musical score, indicating potential abdominal pressure drama. Gastric distension, retroperitoneal gas, terms that might sound like medical jargon, but they're the backstage whispers guiding the narrative. Now, how does one conduct this intricate symphony of physiological responses? It's akin to being a maestro in the operating room. Continuous monitoring of heart rate, mean arterial pressure, and the finesse of adjusting ventilator settings, it's a delicate ballet ensuring the performance goes off without a hitch. Let's start by exploring the physiological changes during POEM. The use of continuous gas insufflation, particularly carbon dioxide, is crucial for the procedure. However, this can lead to physiological changes, including a rise in mean arterial pressure and heart rate. These responses might be more pronounced in patients with compromised cardiopulmonary function. Now, let's look at the adverse events associated with POEM. Early complications range from mucosal injury to subcutaneous emphysema, capnothorax, capnoperitoneum, and pleural effusion. Late complications include symptomatic GERD and esophagitis. Gas insufflation-related adverse events are common, with pneumomediastinum, pneumothorax, pneumoperitoneum, and subcutaneous emphysema being notable. To reduce these complications, it's crucial to use CO2 for insufflation and minimize the total volume of gas. If subcutaneous emphysema occurs, early detection is key. Strategies include hyperventilation for partial relief and, in extensive cases, subcutaneous needle drainage. Additionally, percutaneous abdominal needle decompression can help manage increased abdominal pressure. Moving on to postoperative care, pain management is a significant concern. Postoperative pain following POEM can have various undesirable effects, so effective management is vital. Patient-controlled analgesia, or PCA, allows patients to self-administer opioids as needed. However, opioids can come with adverse events, so combining them with adjunctive medications like nonsteroidal anti-inflammatory drugs and dexmedetomidine can enhance analgesia while reducing side effects. Postoperative nausea and vomiting, or PONV, is another consideration. Factors like general anesthesia and opioid use contribute to PONV. To prevent it, propofol, a known antiemetic, can be used. Serotonin receptor antagonists are also effective, with choices like ondansetron and palonosetron. It's crucial to understand that while POEM offers significant benefits, being aware of potential complications and having a proactive approach to postoperative care are essential. Using CO2 for insufflation, minimizing gas volume, and employing effective pain management strategies can greatly enhance patient outcomes. We express our gratitude to you, our listeners, for joining us in exploring the crucial role of anesthesia in ensuring the safety of POEM procedures. We trust these insights were valuable to you. Your thoughts and questions are important to us. If there's a topic you'd like us to explore in future episodes, or if you have any questions, reach out. Closing, until our next episode, stay curious, stay informed, and take good care. Thank you for being with us, and we'll catch you soon.